Hi, everyone. Have you or someone you know struggled with recurrent urinary tract infections, also known as UTIs? They're uncomfortable, frustrating, and can seriously disrupt your life. But did you know there are effective ways to manage and even prevent these infections? Today, we'll uncover the latest advancements in treating recurrent cystitis, from innovative antibiotics to prevention tips like D-mannose and probiotics. Stay tuned to reclaim control of your bladder health. Welcome to Women's Healthcare Answers. I'm Dr. Jeff McQueary, a Tennessee urogynecologist. And if frequent UTIs are making your life difficult, you've come to the right place. I'm here to provide practical solutions based upon the latest research. Don't forget to hit that subscribe button for empowering health tips tailored just for you. So recurrent cystitis, or frequent bladder infections, is a common condition many women face, especially as they age. Did you know that if you've had 2 or more UTIs in 6 months, or 3 in a year, it's considered recurrent? And although this can feel overwhelming, recent advancements offer new hope. Today we'll explore what causes these infections, debunk myths, and highlight cutting-edge treatments and prevention strategies that can help make living with recurrent cystitis a thing of the past. Make sure you stick around until the end. I'll share a game-changing tip about a new over-the-counter supplement that could significantly lower your risk of UTIs. So what is recurrent cystitis and why does it happen? Well, recurrent cystitis is essentially persistent bladder inflammation, but it's caused by bacterial infections. Some women are more prone to these infections because of factors like a short urethra, childbirth injuries, or menopause-related changes. But here are the main contributors: hormonal changes. After menopause, lower estrogen levels and can weaken the bladder, urethra, and vagina, making them more susceptible to infection. But also sexual activity can cause it. Physical movements during intercourse can introduce bacteria into the bladder. And even the bladder and kidney problems can cause these issues, like incomplete emptying of the bladder or kidney stones that can increase infection risks. But knowing the likely causes of your infections is the first step really in finding the right solutions. So here are some prevention strategies to reduce recurrence. While UTIs won't always be avoidable, recent research has identified effective ways to lower the risk. Hydration is the key. Drinking at least 1 to 2 liters of water daily can help flush bacteria from your system naturally. And try D-mannose. It's D-mannose. This naturally occurring sugar has been shown to prevent certain bacteria from sticking to the bladder wall. It's safe for most people and now recommended by some medical guidelines as part of a UTI prevention strategy. But also use vaginal estrogen creams or rings. Postmenopausal women can benefit from small amounts of topical estrogen to restore the protective barrier of the vaginal and urethral tissues. But other lifestyle tips include urinating after sex, avoiding spermicides, and steering clear of irritants like bubble baths or heavily scented soaps. If these tips are helpful, take a second to like this video. Every thumbs up brings new content to more people who need it. Don't forget to subscribe to Women's Healthcare Answers for more practical, research-backed solutions. So what about treatment options? When an infection does occur, medication is typically the first step. But instead of relying solely on older antibiotics, we now have some promising new treatments. Pivya and Orlinva are recently approved by the FDA, and they're designed for women who don't have alternatives to oral antibiotic options, but they can both poorly be reimbursed by insurance so far and kind of difficult to get, so I don't use them much in my practice. For women dealing with frequent infections, though, long-term strategies that we've used for a long time are low-dose antibiotic regimens or self-administered antibiotics with the onset of symptoms, and that may be considered. However, these should be used under close guidance from your healthcare provider. But there's non-antibiotic management as well. Methenamine hippurate, it's an old drug, but can be used successfully for prevention. Also, emerging research highlights the benefits of probiotics. They help restore a healthy balance of bacteria, especially in postmenopausal women, and especially if you're using some vaginal estrogen cream. Probiotic strains like Lactobacillus rhamnosus and reuteri may reduce the frequency of infections by supporting vaginal and bladder health. But here's the tip I promise. Did you know your diet can play a big role in bladder health? Spicy foods, very acidic foods like a lot of fruits, also coffee, alcohol, and even artificial sweeteners are known irritants that can make your bladder more vulnerable to infections. So consider keeping a food diary to identify and avoid your personal triggers. So I really hope this video and all its content helps you feel more in control of your bladder health. Remember, recurrent cystitis doesn't have to disrupt your life. Whether it's a new medication, the lifestyle changes we talked about, prevention strategies, or D-mannose and probiotics, these are proven steps you can take to break the cycle. If you found this video useful, give it a like and share it with someone who could benefit. Don't forget to subscribe to Women's Healthcare Answers for more empowering and informative content. And as always, drop your questions or suggestions for future videos in the comments below. I'd really love to hear from you, and take care of yourself, and I'll see you in the next video. But an important note, this video is for informational purposes only, and always consult your healthcare provider for personalized medical advice.